So the research that I'm doing in HIV is focusing on eventually getting a cure for this virus, which has eluded us for such a long time now. What I really saw as the value of research was being able to make discoveries that would potentially have an impact on many, many people, and many more people than you would actually be able to reach as an individual physician. So that really was the draw back to research for me.
I think the thing is to find a way to laugh each day.
As long as there's people around you who, you know, really give you love and support every day, it's all I need, really.
So Sarah Garner, what makes you optimistic?
I think, Victor, this was an easy one for me. In the last 6 months, it's been community and connection for me that's made me optimistic. I have some wonderful communities that I'm involved in Melbourne. And yeah, just my connections with my partner, with my pets and family and friends have kept me very much optimistic.
That I think I was born optimistic. I'm one of those people that has described herself as pathologically optimistic from a very young age, and I'm sure it's been annoyingly so for some people over some years. But for me, it's always been about the way ahead. And to me, that always sets in an optimistic view, and you're always seeking what you can take from the present into the future.
I'd like to make the link back to where I started early in the conversation around this notion of strategic optimism. I think we can have the impacts of daily life, we can have things that hurt us or upset us or whatever, and that's just part of life, that's fine. But I think what we can teach our children, we can teach our friends, is how to be more strategically optimistic, how we can actually use the tools of connectivity through the community and leverage that up in a way that makes us more resilient.
I'm Victor Perton, and this is the Centre for Optimism. And I don't need to do a long introduction today. You're all here to hear these brilliant people, and in particular, welcome to Sarah Garner. Welcome, Sarah.
Thank you very much. I'm looking forward to it.
So Sarah is one of those incredible people. She's an infectious diseases physician. She is a medical microbiologist and a researcher at Walter and Eliza Hall, which is an institution in Melbourne we normally call fondly WEHI, and it's been going for over 100 years with Nobel laureates running it and people like Gus Nossel, who went on to head the Gates Foundation Medical Research Fund allocation. And so it's a great honour to have Sarah talking about that wonderful work at WEHI. And then to have Catherine Bennett join us. Catherine is the inaugural chair in epidemiology and has been head of the Deakin University School of Health and Social Development for this entire decade, and has recently stood down from that position, but is leading this fantastic national and international conversation on putting common sense around the conversation on COVID. Welcome, Catherine. Thank you.
Great to be here.
And my dear friend Paul Cooper, Professor Paul Cooper, but I don't know how to describe his expertise. It goes from data
to... Modestly.
He is what you would call in Yiddish a mensch. He is, his curiosity has no bounds, and his ability to connect people together is astonishing. And the work he's doing with us around the Centre for Optimism and Indigenous optimism and the potential for combining Indigenous knowledge to create an Optimism 2.0 is something I'm utterly grateful for. The first thing we always do at the Centre for Optimism is to ask people what makes them optimistic. So I'm going to ask each of our three panelists first, and I'd like all of you, if possible, to add what makes you optimistic on the chat function. So Sarah Garner, what makes you optimistic?
I think, Victor, this was an easy one for me. In the last 6 months, it's been community and connection for me that's made me optimistic. I have some wonderful communities that I'm involved in Melbourne. And yeah, just my connections with my partner, with my pets and family and friends have kept me very much optimistic.
It's needed. That infectious optimism of yours is just so special. And Paul Cooper, I've asked you the question before, so you're well practiced. What makes you optimistic?
Thank you very much, Victor, and it's great to be here. Look, my father always used to say necessity is the mother of invention. We're in a very difficult time on planet Earth, not just with the pandemic, but with a lot of other environmental factors as well. But I'm just seeing an unbelievable amount of creativity and innovation coming out. And that makes me very optimistic. Our challenge is really to harness that innovation in a way that is to the benefit of all, and so we don't end up with more divides. So my passion is all about how we have an equitable sharing around of the innovation and creativity, which I know is out there.
That is splendid. You know that over the last month, we've been helping the Bendigo Invention and Innovation Festival continue to operate through the pandemic. Well, they moved on to the unfamiliar platform of Zoom. They had a budget of 250 registrations. They had 5,000. The theme of optimism, and it was children, it was adults, it was people from around the world. So, Paul, you're helping to put great equity into that innovation equation. And Catherine Bennett, what makes you optimistic?
Look, I have to confess that I think I was born optimistic. I'm one of those people that has described herself as pathologically optimistic from a very young age. And I'm sure it's been annoyingly so for some people over some years. But for me, it's always been about the way ahead. And to me, that always sets in an optimistic view, and you're always seeking what you can take from the present into the future. And I do think it's actually helped me. I've taken a very scientific approach to my place in the media in terms of trying to interpret numbers and unpack it and look at what's happening in broader epidemiological fields. But in the process, in always looking for the things that are working and encouraging the things that are working and trying to get people on board, because ultimately the people are the intervention in pandemics. It's also attracted really fascinating responses from members right across the community, colleagues, business world, coming and talking about this, you know, their valuing of the silver lining approach and the optimistic approach and the energetic forward-looking approach. It doesn't protect you from everything that's going on, but it's certainly, I think, the way forward. And it's also bringing a lot of people along who otherwise were really struggling. And I think that's something that's really important in this really uncertain time. I think that uncertainty really needs optimism to navigate your way through.
On behalf of the optimism movement, thank you, Catherine. Sarah, you're a physician, you're a pathologist, you're a researcher at WEHI, so you're seeing COVID, you're seeing other viruses as both doctor and researcher. So what are you seeing in terms of the understanding of coronavirus, the repurposing of medicines, the realistic progress of the vaccines?
I think the thing that I've been most impressed with in the last 6 months is the collaborations that have been happening between, as you said, between physicians that are seeing patients, between researchers, and also the general public as well. I think that that's something that's been done very well in the HIV epidemic, those collaborations with, as I said, with patients, physicians and researchers. And I'm also seeing it happening with coronavirus. So I think that that's a major cause to be optimistic about what's happening and how we're going with research in the pandemic.
So what are the drugs that you see as having the greatest prospect of being repurposed and what's working in Australian hospitals? We seem to have such a low death rate from the pandemic as opposed to even the European countries, which we otherwise think of as advanced. That's
right. So in Australia, our ICU intensive care mortality has been some of the lowest in the world. And I think that's because of the way that cases have been handled. So as an ID physician myself, I've used dexamethasone, which we know has been proven to help people, especially those that are needing oxygen as part of their illness. So dexamethasone has produced some good results. We've also been using remdesivir as well, which a lot of people will have heard about in the media. That's been used previously actually for veterinary viruses, but it's been repurposed for coronavirus, and that's produced some promising results as well.
So, when I look at your qualifications, it takes you a long time to become a physician. It takes you a long time to become a pathologist. And yet you've now returned to the laboratory to study the cellular structure of HIV. And now, of course, you've been thrown into helping that huge global effort on COVID as well. What drew you back to the research laboratory after a successful professional career, or during a successful professional career?
So I've been interested in research ever since I decided on my specialty of infectious diseases. It gives me a lot of pleasure to be able to treat patients at an individual level. But what I really saw as the value of research was being able to make discoveries that would potentially have an impact on many, many people, and many more people than you would actually be able to reach as an individual physician. So that really was the draw back to research for me.
So HIV, 30 years ago, was in the news every day like COVID is in the news. It's not so much in the news today. So what's the research you're doing in HIV, and what difference will that make?
So the research that I'm doing in HIV is focusing on eventually getting a cure for this virus, which has eluded us for such a long time now. So what we focus on at our institute is actually how our cells handle HIV, and how we might be able to use parts in our cells to actually combat the virus. So cure research is fascinating. We're very lucky in Melbourne to have some very prominent HIV researchers, such as Professor Sharon Lewin, who heads the Doherty Institute. So yeah, it's a great place to be in Melbourne to be researching HIV.
So one of the things, in my work, I've seen Harvard and the American military and Boston University has declared that optimism is the most significant trait in healthy longevity. Not genetics, not geography, not wealth, it's optimism. And we've had Mount Sinai System, the American College of Cardiology, make the same claim in respect of heart health. And I know you, in your early research, as early as 2003, had made that connection. Are we seeing, we just saw Donald Trump, sort of walk out of hospital after only a few days, declaring his optimism. Is there a connection between optimism and HIV survival or recovery, and indeed COVID?
So, Victor, there's not much on COVID yet. I think that it's probably too early in the pandemic for us to be seeing those kind of studies. But there's definitely quite a bit on HIV. So there has been studies that show that if you have a more optimistic outlook, then you do better when you acquire HIV infection. And it also helps to reduce the internalized stigma that some people might have when they acquire HIV as well.
That's a wonderful connection. We'll certainly add that to the information we're providing to the community. Catherine, can I throw to you to ask a question of Sarah or make a comment, and and then I'll ask Paul to do the same. Catherine,
I think it's interesting because there's so much going on in the COVID space. As Sarah said, we're still learning about it clinically and epidemiologically, but there's so much that's happening in the public space, and so I wanted to talk to Sarah about that, because we're seeing some pushback at the moment, and I'm thinking about this because I've just received a number of identical emails around our testing for COVID and the PCR and so on, that I think one of the risks is where people are wanting to understand what's going on, and even approaching that with some optimism, sometimes that gets a bit sort of sidetracked, and I think questioning testing and other things has really come into the fore in recent times, sort of social media and broader space. So I'm just wondering, from Sarah's point of view, from the kind of laboratory end of it as well, how do you see that, and how can we steer that so that we're not just saying, no, you're wrong, but actually bringing people back on board with the confidence in what's happening and belief in the information they're seeing, and I guess putting that energy into something other than trying to question it all the time.
So, Catherine, that's one of the reasons why I've been really interested in doing more science communication in the coronavirus pandemic. I've traditionally been quite a shy person, so haven't done much. But when I saw what was happening in the community and the questions that they had around coronavirus, it really started to drive me to be part of these types of events, because I believe that the more we can educate the community, and as you said, people do actually want to know some of the minutiae about the way we're testing for coronavirus. So I think that we need to give them an opportunity to ask those questions. From a lab point of view, as a microbiologist, I take part in the validation of the testing for the PCR tests for coronavirus. And so I've seen what's happened from the lab point of view in terms of the stringency in reporting of coronavirus tests. So the testing that we do at my laboratory at Dorevitch, we actually look for quite a few different targets for the coronavirus. So for those people watching, we look for a few different parts of the virus before we say that test is positive. So we're not just going off one target. So from a lab point of view, that testing is extremely stringent. It's not only looked at by the scientists that are doing the tests, but it comes to a pathologist such as myself to review before we put it out as a positive result. So yeah, the testing is very stringent, but as I said, I think it's great that people get an opportunity to ask questions as well.
And I think that's really important, because I think one of the challenges for all of us at the moment is a lot of the conversations are polarized. And in fact, it's having the conversations in the middle that allows people, whatever their kind of starting position is, to come back and have the conversation, so that we're all, working with the data in the same, less suspicious and more, engaged way. So I think that's really helpful for people hearing that kind of message, and the more of it we can get out there, the better.
Yeah, and I think that's a very important point that you made about polarized conversations. I was reading a very interesting neuroscience-based article this morning about that, and how, what are the steps that you can take to have more nuanced conversations around topics, and what you might look for, I guess, in your own questioning of things to make you better at having nuanced conversations.
Yeah, and I think it's something we can all hopefully take out of this, because I do think it's interesting. But also, I guess, on that optimistic note with COVID, there's a lot, as you've said, Sarah, about collaboration and even the way we can access research while it's still going through peer review. There's so many things, including rapid access to some research funding to try and really get on top of things, that I hope will be a legacy of this, and those very positive things that we can take forward. But one of those things is experts like yourself and myself as an epidemiologist actually being in the media space in a different way. And just as our poor journalists are also being struck down by, job crunching and all the rest that's going on globally in journalism anyway, let alone with COVID, it does create more opportunity for experts who are developed comfort, and I, like you, people won't believe it, but also shy, to actually be in that public space, but able to communicate in ways that brings the science to people, is something that I think will be a legacy. And the journalists are certainly telling me that this is new to the degree that it's been happening, and again, it might be something that becomes a legacy. You might not want to hear that, and I might not want to hear it because you sort of feel like it's a phase. But in fact, I think it's changed things. So what's your view on that? And what's the reaction you get from people after they listen to you and start to understand your world through the media's eyes?
I think people are very curious about it. And I've found that, the more people have an opportunity to ask questions, the better, to have those more nuanced conversations. And I'm actually seeing a lovely comment from David Benadju in the chat. David's a friend of mine that I've known for a really long time, about living with HIV. And that's what I'm hoping that we can do with COVID, is really have those community connections, because what's driven HIV treatment and research has been those connections between physicians and between researchers and the community. So it's really important that we're talking and engaging with the community as we move forward with COVID.
Paul, what questions would you have of Sarah?
I guess the thing that I'm curious about is how we maintain this sort of strategic optimism, if I could put it in those terms. We've got such a lot of interest at the moment in medical research, perhaps unprecedented, and it's coming out of humankind's self-absorbed self-interest. But how do we best harness that for a very long-term endeavour for a whole lot of areas, not just this immediate pandemic? And I'd be very interested in your thoughts on this sort of strategic leverage, if I could put it in those terms.
I think we need to look at the way our institutes and research organisations are funded for those things, because, as you said, I think it's the real innovation has come at the moment from people being so interested in it. So at the Walter and Eliza Hall, we've got I couldn't actually tell you how many projects we've got at the moment related to COVID. Because everyone is actually really desperate to help and to give their expertise to helping us tackle COVID. So I think that the way to go is to actually have research in many different spaces. For instance, at WEHI, we've got not only drugs targeting COVID specifically, but also looking at how we can use antibodies to target COVID as well. And also a lot on drug discovery about what kind of drugs we may be able to use for COVID. So I think it's looking at COVID in a broad sense and making sure that we've got funding in lots of different areas to keep going.
Another, if I may do a follow-up question, Victor, and I know you want to get to some other questions coming in, but one of the aspects of optimism that I do just put a little caution out there is that for us not to get into blaming the victim when people do fall sick or do get really ill or even potentially die, to say, oh, because they weren't optimistic enough or they weren't thinking in the right way. So I just wonder whether there are some thoughts for how you frame up the importance of being optimistic and thinking positively that doesn't lead into a sort of a victim shaming or victim blaming kind of approach that I've seen a bit of.
Yeah, it is something that I think we need to be careful about as a community. And so I think it is up to, prominent people and people like myself, that we do get that message out, that, some people are going to fall ill with COVID-19 through no fault of their own. And we need to, as a community, be able to support them through their illnesses. So I think that's really important. And that just comes back to, I guess, building our community spirit and really having us all in this together instead of, this person's got this and this person's got that. It's important that we maintain our community.
And I think that was very much the Optimism 2.0, Victor, just linking back to that. That was about the Santalk having the community as part of that optimism connection.
And as you know, the definition of optimism, it's the contemporary definition Harvard uses, the US military, Mount Sinai, Oxford, is not that everything has a silver lining, but it's a belief that good things will happen, that things will work out in the end, and to which some people add, if they haven't worked out, it's not the end. But in fact, the great source of that is the oldest book surviving in English written by a woman is that of Mother Julian of Norwich, who 700 years ago, during the Black Death, during the persecutions, writing in a little cell, said, "All shall be well, all shall be well, all manner of things shall be well." And I reckon that piece of wisdom has survived 700 years. So Sarah, we've got a great question from Yvonne Coburn. And Yvonne, if you would like to ask your question.
Yes, thank you very much. It's a really, really interesting discussion and very helpful. So I will ask my question, and then I just want to make a little comment. So the question really is, there is so much discussion right now about, when a likely vaccine will be available to help us fight COVID. So I guess from your perspective, realistically, what do you think the time frame is? So that's my question, and then I'll make a little comment after that, but I'd love to know.
So I think realistically at the moment, we're looking at least mid next year until we have a vaccine that can be rolled out. So the really interesting, thing that's happened with COVID and with vaccine research for it is that we've had something that's never happened before in the vaccine space. So we've had researchers that have been looking at the vaccine candidates and pushing them through trials, but we've also had in parallel with that vaccine manufacture. So the researchers have been working with government and also with the people that manufacture vaccines to make sure that those tracks are coming online parallel. And so that gives us the best chance of actually being able to roll out numerous doses at the same time, instead of waiting for our vaccine candidate and then saying, oh, okay, we need to think about manufacture, and not having an idea of whether we might have, flaws or problems with the manufacture process as well. So that's never been done before. So I think that that's been a wonderful collaboration with researchers and also with government and industry to get that underway.
And Yvonne, you wanted to make a comment?
Yes, and that's really encouraging. Thank you for that. And I guess the comment that I wanted to make, when you mentioned, having nuanced conversations. So I think in terms of building trust, there is a whole body of neuroscience called conversational intelligence that was pioneered by Judith Glaser about 30 years ago. And so, I would really recommend that, because it is all about how we use we language, how we think about the other, and how we kind of build trust and really assist, I guess, in terms of the production of the happy hormones, more oxytocin in the brain, greater frontal cortex ability, etc. So anyway, to your point, I think the more we can have those kind of we conversations, even in relation to things like vaccine, so that people really are, trusting of what our media and others are reporting in relation to this, because there's obviously a lot of self-interest. So I guess, it's more a general kind of conversation, the more we can have but really appreciate your time today.
Thank you. Great question.
That's brilliant, Yvonne. We often appreciative inquiry also. We at the Centre for Optimism, we love the use of the word and rather than but.
Yeah,
that's one of the things we foster. Even if you don't agree, say and rather than but.
Yeah.
Now, my dear friend Rod Wade, who's in the medical industry in the United States, is beaming in from San Diego. Rod, you had a question.
Thank you, Victor, and welcome, Sarah and Catherine, and it's great to see you, Paul, again. So I work in the U.S. Healthcare sector, and I'm in the prescription drug arena. So our company really processes claims and provides clinical support to health plans, insurers, states, local municipalities, employers who purchase services. So I do a lot of work with manufacturers, and I'm not going to use any names, But one of the things that I hear is that similar to what we see with flu vaccines, which are annual currently in the States, I don't know how often or how regularly they are done elsewhere, the possibility that like some other immunodiseases, you've mentioned HIV, that the ongoing protocol for COVID-19 could in fact be something that is ongoing and may in fact have to be semi-annual or annual and could extend for an indefinite amount of period through the human life cycle. I don't know if that's similar to what you're hearing versus the optimistic, which would be a cure. So a one-time inoculation to make us less or not susceptible to the virus, but more that it may be leaning towards that ongoing treatment to give us a certain level of protection, either on a semi-annual or annual basis. Is that consistent with what you're seeing in your research and in your engagements in the industry?
So the really optimistic part of COVID and vaccine is that coronavirus actually seems to be changing very slowly. So COVID-19 is an RNA vaccine, and HIV is also an RNA virus. So normally with RNA viruses like HIV and also influenza, they mutate very fast, and what that means for the audience is that their checking systems are quite slack, and so they do generate these changes over time that can make it difficult to target with the vaccine. So with COVID-19, that hasn't happened yet. There was one mutation that was being looked at with interest since about the middle of this year that had to do with the spike protein, which I think people would have heard a little bit about in the media. But that's not actually led to major changes in the virus yet. So I think at the moment we're quite optimistic that the vaccines that are being produced might be able to target COVID-19 very well. And that we've got an amazing amount of data that's being looked at and analysed all the time to see if any of those mutations are happening. So the scientists are really on the ball with that.
And Sarah, Paul and Catherine, Rod is an expert in supply chain and logistics and global contracting. And so we'll keep him in the circle for any assistance that you need, because he is, as he's got just 50,000 good friends in his organisation, the International Commerce and Contracting. So thanks, Rod, and thanks for joining us from San Diego.
Sure. I appreciate that very optimistic description of my reach and influence. Thank you, Victor.
Martin Gillespie, you are a great thinker and you're doing wonderful things with men's health now. Do you want to ask a question and share something of what you're doing with the panel?
Yeah, sure. Can you hear me okay?
Yes, Martin.
Yep, cool. So firstly, thank you. And for those who are not Scottish, Victor offers translation skills for those who are not born with Scottish ears. So, you know, hopefully that adds a little bit of humour to a very great conversation. But a few things. I've turned my back on a 25-year in the corporate world to become a holistic coach. And a pivotal point of that actually was 8 years ago, I was diagnosed with stage 4 non-Hodgkin's lymphoma. And I was 41 at the time. I was on that treadmill of life, and it readjusted my life completely. I also discovered that there is a real lack of information for men and men's well-being in the community, not just locally, but globally. If you take it, I've set up in my local community here in Sydney, a men's circle where in the last 3 weeks, 25 glorious men have come from the age of 30 to almost 60 and started talking about their emotions. And we've covered a range of things from loneliness to not being able to communicate with their partners to drinking too much alcohol, which is I think, an epidemic in itself. And again, being Scottish, that's something I'm kind of used to as well. To things like erectile dysfunction, and being able to share that trust with other men has been fantastic. And I would say one of the things that I've picked up what Sarah was saying is the growth of epigenetics within the medical field. I think the public have to learn more about it, and the medical field have got to explore more in that space. Is that something that you're looking at, Sarah?
So I think that's that's fantastic, Martin. So I think that the medical profession are quite behind, as you said, in terms of thinking about those things when we're treating patients. It's something that I've actually become quite interested in the last 4 or 5 years because of changes, as you said, changes in my own life that have led to more interest in that. And so I've been interested in trying to, I guess, treat my patients in a more holistic way as well. Not only do I see patients with infectious diseases, but I also see patients that have had weight loss surgery as well. So it's really important, especially for patients like that, about what's going on in their entire life. I also think it's important for some of the patients, especially that I see that have got chronic long-term infectious diseases, to ask them about how they're doing all of those other things well. So how are they going with lifestyle? How are they going with, deciding what they're going to eat? What are their connections like with their friends and family? I think that it's a really important conversation that is not very prominent in medicine yet.
Look, it's funny you say that, and I'm happy to share with the open audience. One of the thankful things that I feel that I have is the fact that I do get checked up by my hematologist every 3 months. And about 18 months ago, I was playing around with my diet, and I went onto keto, and I ended up getting non-alcoholic fatty liver, not because of the content I was drinking, but more the amount of fats that were happening in my body. And it was a real alarm call. I looked fantastic. I was down to 75 kilos, so I'm 6 foot tall. So that's a really good weight. But I was skinny fat. The visceral fat in me was not good. And it was a great learning for me to go, wait a minute, I might be following a trend, but it's not actually working. And I'm a big practitioner of intermittent fasting is a very good way. But again, if you're putting your body under too much stress, it's not going to work.
And I think that's where individualized medicine comes to the fore. So the patients that I see in clinic after weight loss surgery, and they're very focused on what's the best diet, like what's the one that's going to work for everyone. And it's individualized. So the same thing is not going to work for the person sitting next to you. So we haven't caught up yet, I don't think, with thinking about things a bit more holistically in medicine, and also individualized medicine as well. We've still got a long way to go on that.
I couldn't agree more. I mean, I'm part of an Australasian College of Nutritional and Environmental Medicine, and their aspect is looking at it more holistically to go, if there is a room for functional medicine, but you've got to compensate that with good food and change of lifestyle and toxins that are in your lifestyle. Don't sleep with your mobile phone in your bedroom. Eat a rainbow every day. There are some things that you could potentially, if you want to call it in a corporate world, cookie cut that the general public could do, but people are lazy and they want that quick fix.
I wonder, Martin, that the next question actually picks that up. Those of us living in Melbourne, Rosalind Baker's making us eat our hearts out because she's on the beach at Bondi. So, Ros, your question melds completely with Martin's. Do you want to ask that question? And Paul and Catherine, I'd also like you to join in on this one too.
Love to Melbourne. Well, my question is, my intelligent, well-educated, gorgeous yoga teacher friends who tell me 5G is dangerous and it's linked up to COVID and the government's controlling COVID. They were very angry when Facebook took down for flagged some of their posts. How do you as medical people respond to what I describe as disinformation?
I think that's a really important point, Rosalind. So I'm actually part of some yoga and spiritual communities as well.
Me too, yeah.
So what I've been trying to do is actually, because people, again, it comes back to having nuanced conversations versus the being very one way or the other. So what I've been trying to do is it just doesn't work to attack people head on and say, no, you're wrong. So what I've been trying to do is gently trying to educate through the posts that I make on my own social media. So discussing, what I'm an expert in and what I'm not an expert in, and gently saying, this is what I know a lot about, and I can teach you this if you want me to. But it's very difficult because I want to help and to use my expertise to educate people, but you need to go about it the right way, and it's still something that I'm struggling with.
So Catherine, you've really entered the fray because of both the disinformation and the crazy political debates that are taking place. What's your take on both Roz's and Martin's comments?
Yeah, look, it's a fascinating and in some ways enlightening space to be in, because I think you get a much better sense of how this whole disruption that we're facing plays out and what some of the drivers of that are in terms of people's own thinking. It has created, and pandemics often do this because you have uncertainty, fear, and so on, particularly in the early days, this kind of perfect bed for this disinformation, this, people trying to find answers when they're not given answers, and finding a range of things that that might help explain what's going on or diminish what's going on. And I think all of those things come together. And I just want to say, exactly as Sarah said, you can't put up an adversarial response. You have to actually engage a conversation. And I'll use one example. Our university had a student who'd started putting up things that were registering as some alarm bells. So affiliated with the university, they do watch some of the social media conversations, and she was starting to sound like an anti-vaxxer, and a range of other bits of information she was sharing along those lines that we've talked about in 5G theories as well. And so, good on the university. They didn't just slam her or shut her down or whatever, but they said, maybe you should have a conversation with Catherine Bennett. And I think she thought that was a punishment. I think she was thinking, what's going on here? And they didn't give me a heads up. I just got a cold call from her. But we started talking about that whole thing about being in a space. And she was inquiring. She was trying to figure out what was going on. And so we just talked. And my way of having those nuanced conversations, because I think I'm a natural storyteller, is just to share some of the stories I know. And in the process, you're not trying to convince them of anything, but it presents information in a way that they trust, because you're speaking to what you know about and your expertise. And Sarah's said you've got to, keep to that. But in the very story you're telling, that they come on board with you in that story, it challenges some of their thinking. And so it just tells them that the world's not that simple, that there is more going on, and that they've got more inquiry to do to figure it out. And if a conversation with me or Sarah helps them to come to that realization and not close their thinking down, but open it up so that they're really starting to understand a bit more about their world and what's going on, then I think that's the way you have to go.
Paul, did you want to add to that, and then Rod?
I'll just add very quickly. I think both Sarah and Catherine have responded to that brilliantly. I think there's a responsibility for all of us within our networks to use whatever little or more influence we may have to shine the light. You know, one of the things that I've always loved about the WEHI is their tagline of Fiat Lux, you know, show the light. And so I try to do that with my network by not tackling these sort of claims and so on head on, because that doesn't work, but to try to, you know, direct the 10% or 20% direction to other things which do show evidence-based, do show optimistic sort of pathways forwards. But if I may just share, I'm not just talking theoretically here. I have a family member who's suffering a glioma. It's you know, it's a very difficult battle. She's absolutely 100% certain it came from having the mobile phone in her room. She's gone on an anti-Wi-Fi frenzy. They live in a remote part of the country. All the Wi-Fi has been taken out and so on. And when I went to visit, I was very challenged by how to deal with this. And I thought, look, if I just tackle it head on, I'm going to get absolutely nowhere. So I said to her, how can I best help you get wired up in a way that doesn't cause you any fear? And she said, look, I think if we put those blue cables in and get rid of the Wi-Fi, that'd be great. So I went down to the Harvey Normans. I bought all the router cables and so on. I just wired the house up while I was there. And she was just tremendously grateful, trying to convince her that it wasn't a cause and effect for giving her cancer was just never going to be a winning strategy.
I love that about you, Paul. You are so practical. Rod, you wanted to add just a little comment on that, and then I'll call Caroline Ward next.
Right, and I just wanted to thank Catherine for such a reasonable and measured approach. Paul, your example of how to do this. I find myself engaging with my 20-year-old son, my middle child, on these things. Fortunately, he's more enamored with UFOs and things like that at the point. But I also love the disinformation, because I'm coming to you from the capital of conspiracy theories, the United States of America, followed probably only closely second by Trafalgar Square in London. But I think that it's a tough one. Facebook's action to the question Rosalind originally asked, it's a no-win situation, right? You try to manage disinformation and it becomes part of the same conspiracy theory that's feeding the whole thing to begin with, that the fact that they took it down, right? So I think, I love what you said, Catherine, about having that dialogue. And I love Paul's example of engaging and having a discussion about what does work for you. You know, where are you? Realizing that we've got a real challenge, a societal challenge. And we're only going to get so far with so many people, but we've got to take a more pragmatic approach rather than a confrontational approach. So thank you, Catherine and Paul. I think that was wonderful and a great question, Rosalind. Now, last thing I'll say, we'll get on to the other questions, is I'm not sure I get the kind of tag in between the yoga community, which I find so appealing and lovely. And so maybe I missed something there, Rosalind, but I appreciate what you're saying. It can be anywhere. It can be with your kids, you know, of a certain age. It can be with your friends. So I think these tips for how to deal with it are wonderful. Thank you.
Look, I think Roz is just stirring us up again. They all do yoga on the beach, and you know, we see them on what's that, Bondi Rescue? They're all there in the background. So I think she's just stirring us up, Roz. Could I call Caroline, and to each of the panelists, I think the question is for each of you. So Caroline runs a weekly program called The Optimist Heart. So Caroline, you had a question for the panel.
I do, Vic, thank you. And thank you, everyone. A really tremendous conversation. I'm really enjoying a lot. And my question is about education. I want to circle back to something you said, Paul. I do just want to respond to you, Rod, about the yoga situation. I think what happens, and why, I don't know, Ros, if this is the case, but I think when you go into realms of yoga and, you know, meditation and spiritual thought, you tend to start to practice detaching from the world and the worldview and the agreed norms as they are. So you're open to exploring that there are other possibilities, and you experience things more as an energetic, you're more in tune with energy because you're connected to your body energy, you're connected to a sort of a more it's not virtual, a more subtle experience. So you do feel the impact of things in a way that people who are just trucking along in the world the way it is and don't question the system. So you start to question things from a particular model of the world, which is a more experiential one rather than an intellectual or a lived one. So I would add that in as a kind of, I don't know if that works with what you're talking about too, Ros, but it just triggered thoughts in me about why that might be. I wanted to come back to this point that you made, Paul, which I thought was really sensitive, about not shaming people who might get ill because they're not optimistic enough, which is, in a way, it has a little flavour of this same story of, you know, the way you live your life and you're responsible, which I think is also true, but there are caveats in that. But I wonder if we're saying that optimism really is a genuinely useful and helpful way of averting some levels of illness or promoting longevity. And of course, we're in the situation at the moment with COVID where it's all reactiveness. You know, we're all just, you know, kind of pivoting, spinning on the spot, looking for solutions. But what kind of education needs to be put in place then that young people, kids, parents are actually learning the tools of optimism so that at an immunological level, we've got more resilience because of those particular hormones that are generated or the long view. The guest I have coming this Sunday was a TCM physician, and she was a founding member of coaching at the Harvard Medical Center. And one of the things she found was that when people had a very powerful vision for their life, and most people don't, that they were able to get better a lot faster and a lot more than people who didn't from illnesses, serious illnesses that they had. So for me, it's a question about intervening in the system of education and a more holistic education. So I'd love to hear from all of you on that.
Well, maybe if it's okay, if I can just respond back on that one. I'd like to make the link back to where I started early in the conversation around this notion of strategic optimism. I think we can have the impacts of daily life, we can have things that hurt us or upset us or whatever, and that's just part of life, that's fine. But I think what we can teach our children, we can teach our friends, is how to be more strategically optimistic, how we can actually use the tools of connectivity through the community and leverage that up in a way that makes us more resilient. And for me, the way that I have gone about doing that, just to share, is that on a daily basis, I try to find some way, a new way, or some way of connecting with someone. In my case, a lot of that is done through virtual connections, but it's not limited to that. Finding a way to help in some fashion, whatever that may be. I like to share lots of information out with friends and family, and in my very small way of trying to counteract disinformation, I tend to share out scientific articles, not always about medicine or health, but just positive things that I think will educate and inform. And I hear echoes of those back through distant networks sometimes, so I know that helps a bit. And the final one, and we haven't spoken about humour very much here, but Victor, you might remember when we were talking about Optimism 2.0 and the impact of Indigenous thinking and their wonderful sense of humour in adversity. I think the thing is to find a way to laugh each day. And my wife and I certainly wouldn't be described as rivetingly funny people, but we love to share a joke. And, I read out a little short story normally to my wife while she's cooking dinner and so on. And we try to find books that and stories that are just uplifting and funny. 3 Men in a Boat, a classic from 100 years ago. If I could just pass on one book that is just fantastic from beginning to end. Anyway, I'll stop rabbiting on.
Oh, you mustn't. I've in fact, because my jokes are still from 40 years ago, where they've got ethnicity, sexism, or the like in it. I don't dare to tell a joke in front of audiences now. So I act like a laughter yoga person and just start laughing. And I did an event for Rotary the other day. Everyone on screen was laughing. So I think that, I just had it right 50 years ago, I think. Sarah, you were going to draw in David.
Yes, I'd love to.
Hi, Sarah. Lovely to talk to you.
Hi, David.
Yeah.
So I was really enjoying what you were saying in the chat before about your journey, and I wondered what your ideas were about optimism as someone that's lived with the chronic disease for such a long time. Where do you see the importance of optimism in your story and in what we're dealing with at the moment?
Sarah, I've just had a birthday, and I had something like 150 people say nice things to me. The level of love you get from other people, and I'm sure, I hope I give it to other people too, it just makes your life and your quality of life worthwhile, even though I've had a lot of illnesses, and unfortunately, HIV, because there's no cure, and the fact that I had a whole period where it wasn't treated, has meant that I've built up all these inflammatory responses in my body. So I've had, like Martin, I've had a non-Hodgkin's lymphoma, and I've had a heart attack, and I've had cancer and stuff. So it's sort of like a never-ending treadmill, but as long as there's people around you who, really give you love and support every day, it's all I need, really. And I have to say another thing. We're just talking about the budget and how the people at the bottom end are probably going to be left out of this current budget in terms of their New Start being back to $40 a week. I do think money's important. I do think I've been so lucky to have had a good superannuation policy, and I feel like I can do things I want to do, or, I can have a social life. And I think the friends of mine who are doing it the toughest are ones who are living in poverty. And I don't know how we fix that. And it's hard to be optimistic when you are really struggling in your everyday life. And I know some of my friends sort of gave up the battle a bit because they didn't think they had a quality of life. So it's how you work on those quality of life issues. You don't have to be rich, I'm not saying that. I'm just saying how we look after people, give them a few little luxuries in life, or I don't know, just make sure they're loved, but they've also got things to look forward to in their life. Maybe that's the way to put it.
Absolutely brilliant, David, and you'll see the love already in the comments there. Listen, we've reached the hour. It always astonishes me as to where an hour goes, but we've reached the hour. We want to let people who joined us for lunch, head away if they're back to work or whatever they're doing. So firstly, I'd like to thank WEHI, who offered us Sarah to bring us the wisdom, both hers and from the institution. So Walter and Eliza Hall Institute, it's a wonderful organisation. You can sign up to their mailing lists. You can help them just by amplifying their stories on social media. But of course, $1 or $100 or $1,000 is always worthwhile. And I'll make sure both on the on demand and the like that we get that message across, because it is wonderful work. So look, I'm just wondering if I can skip across the panel. Firstly, it's thanks from me, but I think if we can end up with a sentence from Catherine, a sentence from Paul, and Sarah, if you see us out, a bit like hard quiz, you can do the farewell, and then I'll bring everyone up onto the panel and we can just have a general chat for those who want to stay on for 15 minutes to half an hour. So Catherine, what's your closing message?
Look, my closing message is we're rebuilding this aeroplane while we're flying it, and I think we've had focus on in the media in particular on some of the difficulties, but equally we heard a lot today from the Chief Health Officer here in Victoria about their willingness to learn, you know, as they keep trialling and improving systems. And I think that should give us the optimism that we'll have the public health response we need to ease restrictions and have the best of both worlds, locate cases, but also some more freedoms.
Brilliant, Catherine. Thank you for joining us today. Paul?
Thanks for the invitation.
Thanks, Victor. Look, my closing comment would be social isolation is a real disease, not the pandemic. And if we've learnt nothing through all this, it is about the power of connectivity. And if we can keep that going or even accelerate that as a consequence of the pandemic, which I think we have been doing, that will be a wonderful strategic optimism thing.
And Sarah, I'm glad you got over your shyness to now become a public figure in public health. Sarah Garner, how would you finish off and say farewell to our audience?
I want to thank the community for being involved in such a robust discussion, and I want to say please keep asking your questions and keep engaging, because that's how we're going to keep moving forward, not only with coronavirus but with the other challenges we have.
So Catherine, can I ask you a question? So I'm on the board of Yarra Valley Water, and there were a few other people from water boards that came in and out on the attendees. What's the usefulness in testing sewage for COVID? Because it's certainly being done across Victoria. I don't know about the rest of the country.
I did a story with the BBC on this in October last year, not realising that we'd all be talking about wastewater epidemiology this year. So it's one of those things that we call an ecological study. So it means that you can get information. You don't know who individually it applies to, but it tells you something about what might be going on in a catchment area for the parts of the sewage system. And so as we get to the point now where we're looking for early warning signals, it comes into its own. It's as they found in Sydney, they pulled up a positive step, this positive result. Sorry, emails are flying in now because I'm late for another meeting, so I better go. But they did pull up a positive result, and then did find a case. This current cluster of new community cases was then identified. So I think that that's actually a sign of how this can work. It just tells you the areas where there might be virus circulating. You're never sure whether it's someone with an active or a past infection, or whether it was someone moving through the area, but it certainly gives you a signal that there could still be virus out there, and to start looking in other ways. So it's really about that early warning approach.
If I've got a big pipe, you know, with literally thousands and thousands of people sending their waste down it, one or two people with a case shows up on this equipment.
Apparently so. I mean, they're still validating this, and we now know that there was a cluster of cases in Southwest, and that might have been in the catchment that was picked up. But that's what they're trying to understand. So the more they use it, the more they'll figure out how sensitive it is, and the more cases they find that don't register in the wastewater, they'll also learn more about that as well. So we don't yet know its sensitivity, so how many times it's likely to hit a positive. And we also don't know, we've had some cases in Victoria where they found a signal but couldn't find a case. Doesn't mean there wasn't someone out there, maybe asymptomatic or whatever. So it's not going to be a perfect system, but it's certainly another part of our arsenal. And I think it's then following up those.
That's a well-chosen word, Kat.
I know, I just realised. It's like talking about people passing through and all the rest. So anyway, I'll stop there.
Well, look, thanks, Kath, and you've got another meeting, but just one. We might actually do a whole program on epidemiology, I think, at some point, because it's just, you know, you are now the rock stars of the health industry.
Well, it's other people have said that, and it's interesting that like Sarah, there's a lot of people who've come out from behind lab benches and behind computer spreadsheets, and so it does make the discipline visible, and I think that's been a good thing for epidemiology, and I'm hopeful one of the legacies will be that that we expand the capacity in our workforce as well, because I think I think they're absolutely going to be critical in the way we go forward, as much now focusing on prevention and rapid responses to future pandemics, particularly in partnership with our laboratory and clinical partners.
You work with Mark Pellegrini and Cody Allison. Are there any other stories of hope and optimism we should draw out from your team?
So my team, it's a very interesting part of research. So one of the things that we do is repurpose drugs that are already being used for other conditions, say for cancer, and repurpose them to use for infectious diseases. So the great thing about doing that is that these are drugs that have already been tested and proven in humans already, and so it makes it a much quicker process to get them approved for other conditions. So I think that's a great way of researching.
I think that'd be really, really interesting. Victor, this whole topic's really around translation, getting things out into the field really, really rapidly. And that's just been an area that I've seen in biomedical sciences that's just accelerated beyond all belief in the last few years. That'd be a really interesting one, I reckon, for a lot of people.
All right. Are you going all the way back, Sarah, to interferon and other inhibitors? Are you looking at everything in terms of those drug classes or oncology?
Our lab focuses on cell death mechanisms. So that's mainly what we do.
What's a cell death mechanism?
So there's various types of ways that cells can die. So our lab looks at how you target those different ways of dying.
Ah, fascinating. Well, we hope you enjoyed that episode of the Optimism Cafe, a partnership between the Centre for Optimism and the Walter and Eliza Hall Institute. As I said earlier, I hope you can find time to support WEHI in the wonderful work that they are doing, and we'd love you to get involved with the Centre for Optimism. Just go to our website, you can sign up for a free newsletter or you can sign up as a member, but we'd love to have you involved and sharing what makes you optimistic.